Hi, everybody. Welcome. This is Jared Polis, and we have a very important and timely healthcare roundtable tonight with some experts from Colorado about what this healthcare bill being considered in the Senate actually means for people in Colorado and how it could affect people in our state. Little background, those of you know in 2009, Congress passed the Affordable Care Act, that's known as the ACA. Some people also call it Obamacare. That was actually one of my very first votes in Congress I was proud to take, was passing that bill, guaranteed millions of Americans access to health care. And of course, as we know, no law is perfect. There's a number of bills that I sponsor, that other Democrats and Republicans sponsor that can make healthcare even more affordable in our country. But this bill here does not contain any of those bipartisan items. And of course, the basic framework of the Affordable Care Act decreased the number of Americans with no insurance successfully from 48 million to 28 million. So thanks to the Affordable Care Act, 20 million more Americans have health care. Any other changes to health care need to move forward with regard to covering more people, not backwards with regard to covering less. In Colorado alone, an estimated 500,000 people benefit from the Affordable Care Act in some form. The number of people without insurance has been cut in half in our state to 6.7%. For children in Colorado, the rate of uninsured is even lower, 2.5%. And the Affordable Care Act also made sure for so many families, this means a big deal, that people can't be denied coverage for having pre-existing conditions anymore. That provision alone, which is modified and weakened in this Republican healthcare bill, has benefits over 750,000 people in our state. Like I said, the Affordable Care Act isn't perfect, but the progress we've made is undeniable, and we need to continue to move forward, not backward. In May, House Republicans passed the American Health Care Act, party line vote. No Democrats supported that bill. It would unravel protection for people with pre-existing conditions, deny millions of people access to basic health care like maternal care, and leave 23 million people without health care insurance. Now, what this bill really is, and why you'll hear some people talking about this, it has enormous tax cuts for the wealthy. It basically lowers taxes for the wealthy and cuts benefits for the middle class and working families. In Colorado alone, analysts estimated that 600,000 people in our state would lose access to healthcare coverage if the bill were to become law, and that would be a disaster for everybody in our state. Even those who are lucky enough to maintain insurance under that House bill, their costs would go up 15 to 20% for the insurance they currently had. Now, the Republican bill is very similar to the Senate bill. The Senate bill is just as bad and in some ways even worse than the House bill. That's the one that just came out, developed in closed-door backroom sessions in secret, and the Congressional Budget Office just scored it hours ago. That's the nonpartisan office whose director was appointed by a Republican that gives us the honest, objective costs of any particular piece of legislation. Just today, the Congressional Budget Office said that 22 million Americans would lose their health care under the Senate bill. And that's why we're here tonight. The legislation congressional Republicans are considering would have an enormous impact on our state. And we deserve to know what's in the bill. I'm excited to be with a group of experts who are going to present briefly in their areas of expertise, and then we will very shortly open it up to your questions on both the Facebook platform and the YouTube platform. Once again, this is Jared Polis. I want to welcome you to our town hall. We will be getting to your questions after the initial presentations from our experts, which we're very excited to do. I'm proud that we're up to about 100 people already that are watching this. I see there's a few questions in both the Facebook forum and the YouTube forum. You can post your response on Facebook, and we will try to get to it, and we will also post it on YouTube. Okay, let me introduce our panelists today. And before we get to our panelists, by the way, I have a special guest here today, and I thought it was important to start off with the human impact, because our panelists know a lot about policy, about legislative politics, about health, but we also have so many people, and that's where this bill starts, is what it means to people. So before I introduce our panelists, I want to give Deb Gerlich, a resident of the 2nd Congressional District, and her son Sam, a brief moment to talk about what the Affordable Care Act protections mean to them in their everyday lives. Deb and Sam?
Hi, my son Sam was diagnosed with type 1 diabetes when he was 4 years old. Previously, he was a healthy kid who ate healthy food and ran around like all young boys do. Like many people with autoimmune diseases, it was not poor choices or bad lifestyle that gave him this disease. He was dealt a bad hand with an autoimmune gene that we now know that we didn't even know was in the family. So because of that, he has a costly disease for the rest of his life. There is no cure, and the cost of insulin and other life-saving technologies he is using are extremely high. He has a pre-existing condition. With good insurance, our out-of-pocket monthly cost is about $400 a month. A type 1 diabetic can only live a few days without insulin before he dies. Without insurance, insulin alone is $1,500 a month out of pocket. The rest of the needed medical devices without insurance would bring the cost closer to $2,500 a month. My son is now 20. He will be on our insurance until he's about 26. That is, if we have insurance. After that, if he has a break, for instance, he loses a job, bad economy, somehow he has a break in his insurance and doesn't have insurance for a number of months, insurance companies can offer no insurance because of his pre-existing condition or skinny plans with less coverage that fail far short of the needs of those with serious health conditions like his. I never want my son or anyone with serious health issues to have to choose between being in debt or having care. He was not given a choice when diabetes found him. He and others like him deserve a choice now. Thanks.
Sam, do you want to say anything and add to that about what the Affordable Care Act means to you?
Yeah, absolutely. So, so my father, he's decided to switch career paths, and I'll be honest, I had a couple sleepless nights just worrying about the insurance he would be able to switch onto and not getting covered, and if it got passed before he got a new job and how that would affect me. And I've had many sleepless nights thinking about if I'm not able to stay on my parents' plan, what will that do and how will I be able to afford that right now, if I'll even be able to get insurance. And it's definitely kept me up at night, even though I'm supposed to just be living a 20-year-old normal life. It's not really working out like that.
Thank you so much for that powerful introduction. I appreciate your efforts. Now I'm going to introduce our panelists. And if you could just wave as I introduce you so our viewers know who you are. Helen Royal, the CEO of the Summit Community Healthcare Clinic. Helen, thanks so much for joining us. Helen has been working in the nonprofit sector for 28 years. She started with the Summit Community Care Clinic in 2006 as their behavioral health director. And she moved into the COO role and CEO role in 2016. She's lived in Summit County, Colorado. For those of you who don't know Summit County, home of Frisco and Breckenridge. Very important community health clinic, large immigrant community, large community of people that are on Medicaid. And she's going to talk about a couple of things, the community healthcare perspective, as well as the mountain and rural perspective on the Affordable Care Act. Jean Olzals, the political director of NARAL Colorado. Jean, thank you, Jenna. I know it's Jenna. She's the political director of NARAL Colorado since September of 2014. Before that, she was with NARAL in their development department. She moved to Colorado when she was just a couple months old, and she lives in Aurora. She grew up in Aurora, and she lives in Denver. And I want to welcome Jenna to this call. State Representative Leslie Herod is with us. Representative Herod represents House District 8, Northeast Denver. She captured over 38,000 votes, received the highest number of votes of any state house candidate in a contested race. She's the first African-American LGBT candidate elected to our state legislature. She was president of the student union at CU. And she has worked very hard first on campus to create an inclusive environment. And in her first term, she's really distinguished herself as a leader on reproductive health issues, criminal justice reform, immigrant rights, supporting Colorado entrepreneurs, and homelessness issues. Thank you for joining us, Representative Herod. So first we'll go to Jenna. Jenna, one of the most significant parts of the Affordable Care Act is how it requires insurance plans to cover essential health benefits. That's the word. And that currently includes maternal care. The House and Senate bills remove that requirement. Can you talk about, in plain language, what that means, removing the essential benefits and the language around maternal care?
Thank you, Jared, so much for having us here this evening. We're honored to be involved and appreciate the opportunity to educate folks on what's going on with this bill. The thing to know about this bill is that this is not a bill for women. It is not about women. It does not include women. The word woman is used 3 times in the bill, and only in relation to abortion care and around new work requirements that dictate what people can and cannot spend their own privately earned money and insurance coverage on. Now, when we talk about maternal care, for a country like the United States that has seen significant increases in recent years in maternal mortality rates, this is about as far from pro-life as one could possibly get. We see, there was a fantastic piece a few weeks ago, I believe in the New York Times, regarding why is it that in a pro-life world are we seeing so many dead women? And frankly, it is because we are not putting money into women's healthcare specifically, which of course deals with many things outside of simply abortion, but also deals with that maternal care. And this bill clearly does not take that into account. And it's a very dangerous prospect where we are ignoring an increasing problem that has been happening all over the country.
Thank you, Jenna, for those initial thoughts. For State Representative Herod, both the House and Senate bill deny funding for Planned Parenthood. And in Colorado, Planned Parenthood provides important access in many communities to healthcare, not just for women, also for men, many in the LGBTQ community. What would it mean if Planned Parenthood lost its funding, and what would that mean for reproductive health in our state?
Yeah, I want to talk about 2 things here, and starting with Planned Parenthood. This idea that Planned Parenthood could just be defunded is kind of a fallacy. I think it's a little misleading. But what Planned Parenthood does do is it accepts Medicaid reimbursements, right? And 25,000 Coloradans rely on Planned Parenthood for their reproductive health care needs. That's men, women, LGBT, so all things from cancer screenings to STI treatment and testing and maternity treatment and all of this stuff, reproductive health care that Coloradans really need. And so what this bill will do is it will tell those 25,000 Coloradans that you can't go to the provider that you trust, the provider that you've been going to. You can no longer take those services. And that's a huge, huge problem. Now, specifically for LGBT people and people of color, we use Planned Parenthood at higher rates. And the reason for this is because we know that Planned Parenthood will provide non-judgmental coverage that is comprehensive and that is culturally relevant, right? And that's really important. And so by just barring, Planned Parenthood from receiving Medicaid reimbursements, we're creating a huge problem. And we are all LGBT people, people of color, we already have high barriers for receiving good quality healthcare. I don't know why we would want to create even more barriers to our communities. And so this bill has a direct and huge impact on our communities of color and LGBT communities. Now, just real quick, I'll take off that hat and put on my state legislative hat real quick and just say that this bill is a disaster for Colorado. It will cost Colorado $15 billion over a decade. That's up $1 billion from the House bill. And because we're in a unique situation in Colorado where us as a state legislature can't just raise taxes, we're going to be left with what you see here in this bill, which means seniors will actually have to pay 5 times more for healthcare, up to 5 times more for healthcare than young people. It means the 41,000 veterans who are using Medicaid might lose their coverage. It means women and families will lose reproductive health coverage. I mean, it's small business premiums will go up. I mean, it's a huge problem for Colorado, and I think it'll make Colorado sicker. And I really, really, really want to say that we need to make sure that all of our senators actually get on board and vote against this bill.
Thank you, Representative Herod. And, when you said it cost the state of Colorado over $30 billion, that's kind of what they're trying to do in this bill is make states out to be the bad guys. And states are going to have to cut benefits and throw people off of health care because obviously, as you know, Colorado can't afford to fill that. They can't possibly backfill that. I mean, even if you close down every school in the state and close down every prison in the state, which you're not about to, you still couldn't afford it. So they're basically saying, you know what? We're going to give states so little money that dwindles over time, and we're going to make the states cut out the essential benefits. We're going to make the states throw people off of Medicaid. And unfortunately, if this passes, those will be the kinds of decisions that Colorado will have to make. Let me go to Helen. Helen, in our mountain communities and our rural communities, we have a lot of unique challenges in healthcare, even with the Affordable Care Act, as you know. There's a lot more work to be done. And I know you see a lot of that firsthand every day. This bill, unfortunately, would have an even more negative effect on our mountain communities. I was hoping you could talk about the effect of this bill on community health clinics, on those who need to rely on our community health clinics, as well as in our mountain and rural communities.
Sure, and thank you for inviting me to come along. I'm excited to speak on behalf of the community health centers that are so alarmed by what they're seeing coming with this bill. We are the safety net for people who cannot afford to purchase high-price insurance because their incomes are not at a level to afford what's happened with the exchange. In our mountain communities especially, we have people paying 60% of their income to find housing, and then 25% to pay for childcare. So if it costs 25% of their income to buy healthcare insurance, the math is not adding up. So they fall off the exchange. With Medicaid expansion, many of those people were able to get good healthcare coverage. And primarily that healthcare is provided through community health centers, including a great deal of coverage in our school-based health centers to our kids who are covered by Medicaid and CHIP, which is also on the table. So going forward without that support for our communities is unbelievable. So I hope that our senators can hear that and see that there are real lives that will now not be able to get care, both for mental health issues, dental, primary care, and they'll get sicker. They'll end up in the ER. That's not a great way to save money on healthcare. In our community, about 53% of our patients are still uninsured, even with that expansion of Medicaid. So to think that they would take that away, it's about a 10% drop. So it's huge. Those are real people who could not get care or will choose to buy groceries and pay rent instead of getting health care.
Thank you. Monique Hall asks, what is the impact of this healthcare bill on hospitals in Colorado? Perhaps we'll go to Helen and Representative Herod on that, but how does this affect, you run a community healthcare clinic, I'm sure you have friends and you know the people that run the hospital. What does this mean in terms of a hospital's viability even to serve Medicaid patients, to be able to stay in business in rural areas?
Mm-hmm. So I wouldn't want to speak on behalf of the hospitals, but in meeting with some of their leaders actually today about healthcare in our community, we looked at how can we work together if this funding gets pulled. Again, if people aren't going for preventative care, if they're not seeing their doctor on a regular basis and they have a chronic condition, they're going to show up in the ER to get care. And so hospitals will be greatly affected, especially your rural communities. They cannot sustain that without any kind of reimbursement.
Yeah, and I'll just add that, I mean, I'm just going to be blunt. I think rural Colorado, hospitals in rural Colorado are probably going to be hit the hardest. We have fought this past year in the legislature and previous years to provide to pass a hospital provider fee bill to really provide more funding for our rural health centers, right? And with this bill, the way that it's written now, I'm worried that it won't be enough. And so we're going to see rural health centers shutter and close their doors. I was just reading the Denver Post today, and they were talking about a family in Grand Junction. And if this bill were to pass, they're going to have to pay $25,000 a year for coverage. That's ridiculous, because the subsidies for rural Colorado are removed. So rural Colorado will no longer have healthcare subsidies so that they can actually afford the coverage. It's a huge problem for rural Colorado, and I believe that our rural folks will stand up and say that this is not okay for Colorado.
Thank you. Sue asks, my godson was born out of wedlock. Planned Parenthood provided prenatal support for my godson who was able to, this stuff is flashing up here and I lost it. But in any event, what would this horrible bill do to neonatal care at Planned Parenthood? We'll go to Jenna, and if Representative Herod wants to add anything on that with regard to prenatal care and the importance of it.
So I love this question, and Representative Herod is absolutely right that what we will see from a bill like this is our disproportionate impacts on rural communities. And considering that Colorado is an incredibly rural state, we are poised to be impacted quite drastically from this. Time and time again, studies are indicating that cutting off money to providers like Planned Parenthood actually increases federal spending. It increases state spending as well. Now, while we at NARAL hold the very strong belief that, of course, this type of public spending is a moral and social good as something that we should be investing in, it is also simply the facts just don't match up here. What they want to do is cut spending into communities that need it the most, that are ultimately going to end up having the worst impact along the way. And so we are actually going to end up, by cutting these essential services like this neonatal care that you just brought up, by cutting these services, we will actually be increasing our Medicaid costs exponentially over the next several years. And of course, however long this thing exists.
Thank you. Frank asks, it appears that many nursing homes could be put out of business or have to stop caring for many of their Medicaid elders. Is there anybody who wants to speak to the concern of seniors and those in nursing homes with regard to how this bill could affect them? If not, I can address that briefly, Frank. Basically, by cutting people off of Medicaid and presumably even reducing the benefits of Medicaid, one of the areas of the Senate bill that's worse than the House bill is the House bill, while it phased out and block granted the Medicaid expansion, maintained the Medicaid benefits at the rate of medical inflation. The Senate bill maintains the benefits only at the rate of the consumer price index, which has been very close to zero, 0.5% the last few years. So over time, it erodes the value of Medicaid benefits, even for those who still qualify for Medicaid. And so what you will find is more and more providers, whether that's hospitals, nursing homes, or doctors, will simply not economically be able to accept the number of Medicaid patients that they accept today. Let me go to Suzanne, who says administrative costs for acute care comprises 35% of the total cost of a hospital stay. What ideas do any of you have, and if not, I can answer it, to reduce or streamline administrative costs? Perhaps Helen, as somebody who runs a community health center where you watch every dime very carefully, what do you do to reduce costs and administrative overhead at your community health center?
So part of what we do is make sure that we are the most efficient and comprehensive with every visit, with every patient. So our percentage compared to that is 14% of overhead compared to, I think she said 35. So that means working everyone at the top of their license, making sure that we're as efficient as we can be. And you're right, watching every dime spent, because we'd rather spend it on caring for patients than overhead.
Yeah, and I think that there are absolutely additional avenues. I mean, one of the things that I hear from providers is the overhead associated with billing and account collection. That could be fixed in a number of ways. It could be addressed through a bundled payment strategy that some states have implemented around specific conditions. There's various ways to do that, but that effectively is overhead that providers and hospitals have to take on because of the multiple payers and multiple rates that doesn't go to patient care. It's kind of unrelated to patient care. Perry asked, what is the specific tax on the wealthy that's part of the Affordable Care Act that be repealed? There's several of those, Perry. It repeals the tax on investment income. That's, I think, 2.8% or so. It repeals the tax on the wealthy to finance Medicare and keep it solvent. It repeals the tax on the health insurance industry. It repeals the tax on the medical device industry. So it has a number of taxes changes that would disproportionately benefit high-income Americans. One example is capital gains. So it would reduce the capital gains rate. This is the rate of gain on investment income. And for the first $250,000 of income, it's actually a lower rate. So we're talking about people who make more than $250,000 a year on investment income alone. And what it does is it reduces that rate from 23.8% to 20%. So if they're making millions of dollars, it reduces their tax bill by almost 4% each year, basically with the benefits taken out of middle-class affordability for healthcare. We have a question from Dawn about what improvements we would like to suggest for the Affordable Care Act. And she also asked, why haven't we approached the administration, the Republicans, with any? I'd like to point out that we have many ideas. I do. We as Democrats do. I'm sure that everybody on this town hall does. Those are not being considered by the Republicans. They did not invite us into those back rooms. In the House, they didn't even allow a single amendment. I offered 3 amendments in our Education and Workforce Committee to the healthcare bill. I offered an amendment around pricing transparency to require providers to have the transparency for pricing, to have a real operational market. I offered one for reimportation of prescription drugs, and those were defeated on party line votes. Let me go to, we have one from Adela, who is going to answer Frank's question as well. Adela had technical difficulties. She was hoping to be on this call. She said the Kaiser Family Foundation has a side-by-side table that describes Medicare impact. The repeal of certain revenues would reduce the trust fund by $117 billion by 2026. So does this Republican repeal of the Affordable Care Act impact Medicare? Yes, it does it by giving additional tax cuts to the wealthy, money that would have gone into the Medicare trust fund to maintain Medicare benefits. Let me go to Ed Powers. Dialysis is provided by the Affordable Care Act. The expanded Medicaid pays 20% of the cost of treatment that Medicare will not pay. Where can the 20% of Medicaid payments for, how can the 20% of Medicaid payments for dialysis be paid for? And I think he means for people that are then no longer covered by Medicaid. If there's anybody on this that would like to address that. Helen?
I can address, I don't have an answer, but I can say that right now we have such difficulty with specialty care, even with Medicaid, and trying to get specialty care for someone with no insurance is near to impossible. So it's a dismal look going forward, and it's a big reason why we need to keep that pool of funding for people who simply cannot get the treatment without that coverage.
Thank you. Chris mentions tomorrow I place my 80-year-old mother in long-term care. After 1 month, her income will be exhausted. What will this do to her Medicaid benefits? Now, I want to be clear, this affects Medicaid more than Medicare. Probably the basis of the long-term care is Medicare. I don't know too much about the specifics of your mother's situation, Chris. But again, the threat to Medicare is not immediate, but it will make the trust fund insolvent sooner, meaning they're going to force cuts to be made to Medicare benefits sooner rather than later, but that doesn't mean this year or in 5 years. It could mean in 10 or 12 years, but we still worry about it because it is fiscally irresponsible to remove $117 billion from the Medicare trust fund over 10 years just to fund tax cuts today. Robin says, thank you for this. The repeal bill will literally kill my husband. He's severely disabled. You know, and it's important to point out the human element. We had, of course, Deb kick off our call, but this really is a life and death issue more than any other for American families. It's actually people will live or die based on what happens with this bill. Sandra asks, is there any kind of, let me just see. She asked about natural substitutes, I'm thinking, for healthcare, for her eyes, her ears, teeth, and mental health included. Very interested in alternatives, natural alternatives to prescriptions, it sounds like. And there was some progress with this in the Colorado exchanges. When we had a co-op in Colorado, they did allow a certain amount of money to be used for those kinds of treatments. Those are fully allowable under the exchanges. All kinds of insurance are more affordable for people under the exchanges. It simply relies on consumer demand. Enough consumers have to want an insurance policy that allows them the flexibility around spending for that to be offered. Linda asks, how will the state waivers of essential benefits affect lifetime and annual limits and pre-existing conditions. Do we have anybody who wants to tackle that one, the lifetime limit question and pre-existing conditions?
Well, and to the question before, I would say that when it comes to natural remedies, those type of situations and alternative medications, Colorado has actually made progress to allow that type of coverage. I'm very concerned that with the way that this bill is written and the impacts it will have on Colorado, those will be some of the first types of coverage that will be taken away, that will be rolled back. And they will be done in the name of cost savings, and will be hugely problematic. But we will have to cut, and we will have to cut deeply in order to meet what's happening with this bill. So the same will come for these other types of care. I have asthma. And I'm concerned that there are a lot of loopholes and backdoor policies written into this bill that would allow for a reduction in coverage specifically for states like Colorado who can prove that they can't afford to pay for it. And so I'm very concerned that this bill will have disastrous effects in Colorado. And when we get it at the state legislature, these are the decisions that we're going to have to make.
Yeah, as I said, they're really making you guys out, Representative Herod, to be the bad guys and gals, because they're saying states are going to have to be the ones to decide who to kill, essentially, who to rob of their benefits, because they're cutting funding, and there's no realistic way in our state to backfill that. Maybe a small fraction of it, but certainly not a substantial amount. Karen asks, she doesn't buy, some of the things that Democrats are offering. She says, what is the real alternative healthcare plan from Democrats? She likes to protest, but she wants something to promote and talk about. I want to let people know where I am personally on this. I'm for a universal single-payer system. I sponsor that Bill 676. But I want to point out there's not a majority in Congress for that, and I certainly support it. But there's a lot of other improvements that can be made to this healthcare bill as well, whether it's pricing transparency, reducing the price of prescription drugs by allowing reimportation, allowing Medicare to negotiate the rates for prescription drugs, allowing people in that range right before Medicare, let's say 55 to 65, to buy into Medicare. That would be another example of an option. So there are plenty of people talking about all of those options, but what's on the table now is literally life and death. And that's why the focus is defeating in the next week this bill that we're learning more about today, which causes so many problems. Karen asks, wouldn't universal health care make it so much easier for people to start and continue businesses? Isn't creating jobs an end goal? Why would companies employ people in America if they can go to countries where health care is already funded at a lower cost by the state? I certainly, as a former entrepreneur, agree with that. It is a huge burden on American businesses, not only for the cost of healthcare, but also, frankly, for the administration of it. They have to deal with it. The burden is fully on American companies. That's not something that other countries do. They let companies go about their business of focusing on their core value proposition and their growth. Jeb asks, please speak to how mental health and substance abuse treatment at community mental health centers and for those on Medicaid will be impacted. Who would like to address mental health and substance abuse issues?
Pick me. That's a huge issue for us. We provide very comprehensive substance abuse and mental health services at community health centers and also in partnership with community mental health centers. So any kind of cut in funding or insurance availability keeps people out of those services and has a bigger impact not only on their families, but on their job places, on their communities. So there's a huge concern on how we continue that. How we solve it at community health centers and at community mental health is we do a sliding fee based on their income, but the cost of that to our centers is crippling. So it makes us look at limiting services to make it viable, and that's not helpful. That's not helpful for people who need that service, and we know in the communities and in the whole country that the need for mental health and substance services is doing nothing but exploding.
Yeah, and can I just add that the majority of, the majority of Coloradans that seek mental health treatment and substance abuse treatment, especially opioid treatment, seek it through Medicaid. Okay, so when we're talking about cutting Medicaid, we are talking about reducing treatment for these vital programs. There is, I saw a little $2 billion piece specifically for opioid treatment in this piece of legislation. And the issue there, again, is $2 billion is going to be a drop in the bucket compared to all of those folks who are going to lose coverage. And so, I mean, you hit the nail on the head. I mean, we are going to lose treatment coverage for Coloradans.
Thank you. I'm going to try to bundle two questions together now. One is about from Neil, who says, please speak out about how this bill would affect our disabled community who depend on Medicaid for employment opportunities, medical costs, and a better quality of life. Along with that, Deb Knox had a good question about why healthcare rates are going up so fast. Isn't there anything in this bill about getting better outcomes and reducing costs, which there's truly not. This is not a cost containment bill. It is a coverage reduction bill. Less people will be covered. None of the bipartisan ideas we have around actually reducing the cost of healthcare are really represented in this bill. Who would like to speak about the importance of Medicaid for people being able to go back to work, their quality of life, all of those things that are important for Medicaid recipients?
I can speak to that in a general sense around if people have chronic illness of whatever kind, be it mental health or physical health, the sooner we can support them and help them get back on their feet, the sooner they can get back into their communities. So again, many of those people are covered by Medicare, disability, or Medicaid, and without that, they can't get the services to then get off sometimes Medicaid to earn enough to be able to buy their own insurance and move forward. So it's huge for that population.
Elliot asked, would the idea for pricing transparency be a mandate, or would it be something pertaining to whether there should be a presumption that an agreement on price, often important for forming a contract, was made in the first place? The hook on this, Elliot, is if they want to accept government as a payer, meaning Medicare or Medicaid, they would need to have published pricing and be transparent about their pricing. For a market to work, you need information in the marketplace and consumers to make informed decisions. There's issues with informed decision making because in some cases there's only one choice to make with regard to healthcare. But let's say we're in a city and there's multiple choices. Without pricing transparency, there is no downward pressure on pricing, either from the self-pay or the insurance side. So that's why that's so important. But because in general, providers accept payments from our public payers, presumably they would all participate because Medicare and Medicaid are both important funding streams for our healthcare. Jeremiah asked about treatment of the opioid epidemic. Representative Herod, do you maybe want to update Jeremiah on some of the state efforts with regard to opioid and drug abuse?
Yeah, so again, I believe that Colorado is far behind on providing true access for treatment in this area. And we have a lot more to do. But led by Representative Brittany Pettersen, we have made a lot of gains in the state legislature around opioid treatment, specifically using marijuana cash fund dollars to provide for treatment programs in some of our hardest hit communities. That's a great step in the right direction. But again, if we're losing funding, we're going to have to find another place to fill these holes and to even just get us where we need to be to provide base level treatment for folks who are hit by this opioid epidemic. And we're already behind. We're doing better. I think, the legislature is considering a lot of different ideas, making sure that we have expanded treatment options for mothers who are addicted, ensuring that we have more funding for to pay to get to your treatment provider in rural Colorado is a huge expense and it takes a lot of time. So trying to figure out ways to pay for that. Now, again, if we are faced with a $15 billion shortfall, all of those options are going to be pulled directly off the table. We're not going to be able to consider any of that growth, and all we're going to be doing is cutting. I'll remind folks who are watching that Colorado must pass a balanced budget every single year. We cannot raise taxes, which means we are in a deficit. We will be in a deficit next year. And with this plan, we will be in even more of a deficit. And quite frankly, I don't know how we're going to fund any of these programs.
Thank you. Dawn asked a question, why can't we look at costs, how to control costs, especially for routine test procedures? Example, this is from Dawn. I paid $2,500 for an ultrasound at a hospital radiology department and then $250 for the same at a specialist office. This happens regularly, and it might be one of the efforts that our state needs to take up with regard to implementing reference pricing with regard to common procedures like ultrasound. Those can be implemented across state employees and help drive from the Medicaid and state employee side, the private side, to follow suit with regards to reference pricing with regard to procedures. The transparency that I mentioned earlier would also help address this, because if one person was charging $2,500 for an ultrasound and another $250, and that was information available in the marketplace, people would go to the $250 one, assuming it was the same quality. Afton asked, what about Medicaid funds used in schools for early intervention services? And I want to highlight this because I'm, as you know, care deeply about education. Medicaid touches so many different things. Our schools are one of them. It supports active personnel in our schools that help meet special education plans, that help provide insulin injections, that help kids with emergency conditions or chronic conditions in our schools. And if that was eliminated, our school budgets would be stretched even more thin in many cases by having to shift resources because they're absolutely necessary expenses. Yet another one of the items that comes from the Medicaid budget. Adele, go ahead. Gemma, go ahead.
I'm sorry. I was just going to add in that we're getting a lot of questions tonight about Medicaid funding, and this is such an incredibly important thing because I feel like a lot of people don't recognize that through the provisions of the ACA, over 11 million people have now received access to health insurance coverage because of this provision, is specifically tied to Medicaid. So when we're talking about Medicaid dollars, we are talking about 11 million people who could literally be dealing with a life and death situation on this. This is a huge amount of people. This is not just, you might know a person who's dealing with it, but I guarantee you know some of the 11 million people who are, and every person on this call knows that. And the Affordable Care Act, while problematic in its ways, it should be expanded and built upon in a lot of ways. And these types of provisions that got 11 million people coverage is something that we should be applauding and figuring out how to improve, not destroying. Just my soapbox for a moment.
Thank you. I'm sorry, I went away for a second. I'm back. James asked, if the Senate bill passes, do you think there will be a push for universal health care in the 2018 elections? Without getting into the politics of it, I just want to be very clear with people. The Senate bill is nowhere beyond imagination. It is not a step towards universal health care. It is the opposite. It is a step away from universal health care. My goal is universal health care. I hope that I think that's James's goal as well. This takes us further from universal health care, not closer. As an elected official with responsibility for the lives and deaths of people this impact, it's important that people know that by more people dying and people having more misery, it does not mean that we're suddenly going to get an amazing universal health care. This is a step in the wrong direction. 20 million people less will have health care if this passes, making it harder to ever pass universal health care because it'll be a bigger problem to solve than it currently is. We have time for 2 or 3 more questions if you'd like to post them in the chat over on YouTube or post them into the Facebook question. We're getting a lot of positive encouragement, people saying thank you for this and asking what they can do. Some people are mentioning what they're going to do. Karen asks, don't citizens have a dedicated line item on their paychecks for Medicaid and Medicare? How can the dedicated line item be handed to wealthy people? So there is a cap on that, Karen. So above a certain income level, same with Social Security, you don't have to pay that surcharge if you're above a certain income level. This would effectively reinstate that cap. So on the higher levels of income, there's not an additional percentage withheld for Medicare.
We have the same concept with Social Security, for instance. You've seen that deducted from your paycheck. That is only up to about $116,000 a year in income. So if you earn $180,000 or $116,000, the same amount is deducted from your paycheck. So that is what that means. It would not allow the Medicaid withholding to keep up with income. That's how they form that particular tax cut for the wealthy. Let's see what we have here. We have so many questions and only time for a few more. Let me see here. Dory asked, what can we do to educate people in rural Colorado about what this bill means to them? Let's go to Helen and Representative Herod to talk about what message would you send to rural Coloradans about what this bill means for you?
Okay. So I would just say that for rural Coloradans, this bill is bad medicine, right? It's bad medicine for rural Colorado. You need to get active. Please activate and talk to your senators about how bad this bill is for rural Colorado. I mean, the best thing that you can do is call every single elected official that you know, that you don't know, that is connected to Colorado, and not only ask them to vote against this bill, tell your personal story about how it will impact you in rural Colorado, and then ask them to talk to their fellow senators about it too. So it's not just their vote that they need to utilize. They also need to speak to the other senators and ask them to vote no as well. Again, this bill will be disastrous for all of Colorado, but it will have a huge impact on rural Colorado as well.
And I can go ahead and add to that, in that I think one of our challenges is around the misconception of the type of people who are on Medicaid. 75% of people on Medicaid work and are just not able to afford their own insurance and their the cost of living in the world. And I think that's important for people to know. These are your neighbors. These are hardworking people. There may be all different kinds of challenges. It's a type of insurance. It just happens to be government funded for people who are the most vulnerable, who cannot afford the high insurance prices that we have. The other piece of that is it's cheaper than having people not covered and accrue huge healthcare bills that cripple the system on a nationwide level. So I think people get short-sighted about Medicaid costs a lot of money. It saves money and it covers people and it gets better health outcomes.
Great. Let me go to a few more. Chris Johnson, my daughter, a single parent due to the heroin crisis, sold the house that she bought at age 21 to buy a teeny home, plans to live in an RV park for the next 3 years while she pursues her dental hygienist degree. She'll work on campus making $900 a month. My 6-year-old granddaughter, will she lose her Medicaid? Will they be protected? So look, this is what we're basically talking about with this. To be clear, these bills do not eliminate Medicaid, but they will force states to reduce the income level of people that are eligible for Medicaid. And the Senate bill, even worse than the House bill, will erode Medicaid benefits over time. Now, at $900 a month, in my estimation, even for a family of 2, she would still be eligible for Medicaid even without the Medicaid expansion. I'm going to have my people check on that. They're saying yes. So they don't have to worry about that at $900. But what you would have to worry about is she's trying to better herself. She wants to work a second job. She's trying to bartend on weekends. She's trying to earn a little bit of she would risk losing 100% of her Medicaid if she increases her earnings just a bit beyond that. We'd have to look up the exact figures, depends on if it's household or of 2 or 3 people. In addition, the value of being on Medicaid will be less today, Chris, less in 5 years than it is today, because people will, it will be eroded because of the lack of an inflator for that. Let's see, we have Lisa asks, how will this bill affect Medicaid buy-in programs? I have Medicare and working while disabled Medicaid buy-in program. Medicaid covers my medications and the 20% Medicare doesn't. I'm terrified. So again, on the specific questions of how it could affect you, it depends on exactly what your income level is. What this does is it will force the state to reduce the income threshold for being on Medicaid, meaning that you will have to earn below an even lower level. What does that mean? People will actually be forced to work less and earn less if they want to stay on Medicaid. One of the best parts of the Affordable Care Act is that it encourage people to lift themselves out of poverty without risking their health care by not cutting off their health care 100%. It expanded Medicaid, and as you earn more, you still would get subsidies within the exchange to afford health care. One of the things I always used to hear from people, and it was just heartbreaking before the Affordable Care Act passed, is people who would say, my boss wanted to give me a raise at work, but I had to turn it down. They offered me overtime. I couldn't take it because it would mean I would lose my health care. The exact opposite of what incentives should do, and something that the Affordable Care Act at least partially rectified. Lynn asked, the bill if passed would leave many of our vulnerable citizens without coverage. Recommend making improvements to the current Affordable Care Act. Everybody needs health care at some point, and everybody should have health care. I do want to give our panelists on the call the opportunity to talk about ideas you have for improving the Affordable Care Act, either at the state or the federal level. What do you think that we could do even better so we can end this call on a positive note? And hopefully, if this repeal bill is defeated, we can get back to work on bipartisan ideas to make healthcare better. Why don't we go across why don't we start with Helen?
I wish I had the magic answer. One of the things I think the state of Colorado is doing is really forcing the measurement of outcomes and quality of care. And that means for community health centers, in order to get reimbursement, we're going to have to start proving that we are producing outcomes. And I think there's a good link between outcomes and cost, and really looking at costs and how to reduce that and give better care. So that's one idea.
Okay. Jenna, what idea do you have for improving the Affordable Care Act?
Oh, I have so very many ideas on how to improve that. You know, I think first and foremost, something that the Congressman, Jared, of course, has been a little bit, I'm sure, too polite to say is that we don't have a majority in Congress that will actually listen to a lot of these different ideas. So we could sit here, and I'm sure that people like us could sit here and talk for quite some time around different ideas of what we would like to do. But the fact of the matter is we don't hold a lot of power right now. And the way that we get to that is by making sure that we have people in those positions who will actually listen to those ideas. So step number one, elect people who will listen to ideas on how to improve it. Step number two, make sure that the communities that are most negatively impacted. This bill was written by supposedly 13 men, including our own Senator Cory Gardner, who apparently never saw it until a few days ago. Let's make sure that women are included in any type of improvements or any type of drafts that we are doing to make sure that women's coverage is not limited to one specific thing. Let's make sure that the disabled community is included to make sure that their specific needs are being met. And let's make sure that communities of color, et cetera, et cetera, et cetera, are being included to make sure that anything that we are doing that either expands, improves upon, or hopefully completely disintegrates this mess of a bill that we see right now, and moving forward, make sure that that actually involves the communities impacted before we put it on bill paper and sign it into law.
Thank you. Representative Herod?
Yeah, and I think we have a lot of different ideas that have floated around Colorado and the legislature here. One thing is that we do want to see the states have more flexibility in the Affordable Care Act and how it's implemented. And so I think increasing that is always important so that we can create specific interventions that work for Colorado. I think the other thing that we can do is lessen the burden on, say, small business owners and single business owners, and so that they can actually afford care as well. I know that some of our small businesses are already struggling, and paying for healthcare even with the subsidies is still really tough. And so ensuring that our small businesses are at the table and having this conversation with us is really, really important. So I would really start there. I would be remiss if I didn't say that we have to call Senator Cory Gardner and ask him to vote against the bill with his friends. I don't know if he'll be providing a number at the end on this call. I'm happy to provide the number. I do have it.
Well, let me thank you. Let me also say that we have over 3,000 people watching us right now. That is a record for these kinds of topics, but it shows how many people care about healthcare. Debbie, I want to give you the chance to close, if you will, and before I do a quick wrap up. But as you know, Debbie, House and Senate Republicans are moving so fast to pass this legislation. I worry that by moving so fast, they're not considering families like yours and how it would impact you. What message do you have for congressional Republican leaders who are so intent on passing this bill over the vast opposition of the American people? And I would point out, just in my own office, I've received 4,615 letters against this Republican health care bill and 101 for it. 4,600 to 100. I've never seen that kind of ratio, and yet Republican leaders are still racing to pass this against the clock. Debbie, what message do you have for them?
Well, I would like to tell them that I don't wish any disease on anybody. The diseases don't come, we don't choose them, they choose us. I don't wish them any diseases, but I do wish them empathy. And I wish them to look at the families who have these diseases, who have health issues, who are on Medicare and Medicaid, and look at them and have empathy towards our families and our friends and our communities and our country as a whole.
Thank you, Debbie. I want to thank each of our panelists for being here tonight. I want to thank Adela as well for contributing in the chatting box. She was going to be on, wasn't able to because of technical difficulties, but she answered a number of questions very capably in the chat box on YouTube. And I want to thank all of our panelists. I want to thank Debbie for sharing a personal story. That's, for those of us who are talking about the 20,000 foot level, it's one thing, but I want to thank you and Sam for being willing to put yourself out there. Throughout our country in Colorado, there are millions of stories from people like Debbie who benefited from the Affordable Care Act. And that's why this conversation matters so much. It's important that people step up and share their stories about what the Affordable Care Act means to them. Now, we all know no bill is perfect. The Affordable Care Act isn't perfect. If this effort to repeal it is defeated, Democrats and Republicans will hopefully be able to work together to reduce costs, expand coverage, and and improve the quality of care. But the closed-door secretive process, without any Democrats, without any stakeholders, and even without most of the Republicans, clearly is not the way to move the ball forward, as is shown by this bill, which is an enormous tax cut for the rich, while 22 million Americans will lose their insurance. Those lucky enough to keep their insurance will be forced to pay more. There's rumors the Senate may vote on this bill this week. The House could even vote this week as well, perhaps even over the weekend if they force us to stay here to do that, sending the bill to Donald Trump's desk immediately. Over the next few days, I'm doing everything I can to fight back against this disastrous bill. We'll be taking to the floor. We'll be doing every procedural motion we can and working hard. And I know that many of you will as well, to defend the progress that we've made under the Affordable Care Act and move forward, not backward. Thank you again for being here tonight. If you'd like to stay up to date on my healthcare work, you can sign up for my newsletter at polis.house.gov. You can follow me here on Facebook or on Twitter, Rep. Jared Polis. Thanks again to our panelists, and thanks to the over 3,000 people that joined us for at least some segment of this call tonight. Thank you all, and have a wonderful day.